So, hello everyone, good day to all. So, today we are going to talk about the pharmacology, the very important MCQs and the topics. Okay, na? So, guys, please master this. At least master this. Who are very weak in pharmacology, please at least master these topics before going to the exam. Okay, na? So, myself, Dr. AJ Moria. I also cleared FMG in July 2024 in the very first attempt. So, guys, for the PDF, the link in the description. Okay, so let's go. Okay, here it. Please read the question. Read the question carefully. A 45-year-old woman with a diagnosis of schizophrenia on antipsychotic medication for over a decade. Remember, over a decade. Okay, her family noticed that she has been experiencing involuntary movements for the past few months, including facial facial grimacing, facial grimacing, and lip smacking and jerky movements of her arms and legs. So what is the drug of choice for this one? Remember, she was on antipsychotic over decade. Okay, so you have to take this point over decade. She's having lip smacking and facial grimacing. So these are the side effects of what? They are the side effects of what is the tardive dyskinesia. If you remember, if you see the question, they are talking about the like they were taking the drugs over decade means it is going to be your case of tardive. Okay, na? Tardive dyskinesia. Tardive dyskinesia. We are having the lip smacking, chewing, tongue protrusion. Okay, na? In the case of tardive dyskinesia, or the drug of choice is what ama valbenazone. What is the valbenazine? Okay, na? Drug of choice is the valbenazine. Okay, na? Sorry, this is the okay, na? This is the answer. Okay, na? Oh my God, this okay. This is the answer. Okay, na? Valbenazine or tetrabenazine. Okay, na? Remember, na? So remember, these are the extrapyramidal side effects of the antipsychotics, mainly mainly typical. Okay, na? Can you tell me what happens in the what is happening in the schizophrenia? In schizophrenia, there is a increased number of dopamine and serotonin. Dopamine and serotonin. That's why we're getting what schizophrenia. So what we have to do here in the typical psychotics, guys, we are going to block the D2 receptor. We're going to block the D2 receptor. So these are D2 antagonist. What about in the atypical? In the atypical, what we are going to do? In the atypical, we are going to block the both D2 receptor and 5-HT2, and we have to block the serotonin receptor also. Okay, that's why, guys, we are going to block the only D2 receptor. That's why we're having the more extrapyramidal side effect with the typical antipsychotics. But atypical, we are having the very less extrapyramidal side effects. Okay, na? So let's remember this one. So if the question says that the patient was started the antipsychotic medication within they will take the duration like within 2 to 3 days, within 1 to 5 days, he develops sudden muscle contraction. Okay, now there is a torticollis of neck, means there is a twisting of the neck, trismus, and eye rolling upwards. So these are the classical findings of Fatama acute dystonia. Acute dystonia. So what is the drug of choice? Is the anticholinergic. We have to use the benchtropine. Okay, na? Benchtropine. Then next one, drug-induced Parkinson. So guys, see, mostly see these all the typical all these extrapyramidal side effects are mostly happens with what amma? Mostly it's going to be happens with the haloperidol. What is the ma? Haloperidol. Haloperidol. So haloperidol. So mostly see among all the typical antipsychotics mostly EPS is going to towards the happens with the mostly with the haloperidol only. So okay, they will tell that okay, a patient is on haloperidol. He developed this, meaning they are asking about the EPS. Next one is a drug induced Parkinsonism. It is the bradykinesia, rigidity, tremor. That is the course tremors. There is rabbit syndrome. There is a perioral. That is perioral tremors. Okay, now if they started within 5 to 30, the symptoms will come 5 to 30 days, guys. This is going towards the what? Drug induced Parkinson. You have to give the anticholinergic drug. You have to give the what? Trihexyphenidyl or benzotropic. Okay. Next one, akathisia. Akathisia also, this is a they'll within the few months, okay, now 1 to 2 months. So for example, they will tell a patient is on antipsychotic medications on since 1 month, and he was developing what? He was developing restlessness, meaning he can't sit on a place. Okay, na? He can't sit in a particular place. He will always go here and there, here and there, here and there. Okay, he will always anxiety to go there somewhere. Okay, na? He can't sit in one place. Okay, na? There is subjective feeling. There is a subjective feeling. Okay, na? So among all these, which is the most common EPS? It is the akathisia. Okay, na? So drug of choice is the propranolol. And also you can give the lorazepam, which is a benzodiazepine. Okay, na? The intermediate benzodiazepine. Next one, tardive dyskinesia. I already told you. You have to tell that. You have to see the question that we will tell since years. Okay, na? Next one, NMS, that's a neuroleptic malignant syndrome. Here, it is a very life-threatening complication. Here we are having the fever, okay, na? Fever, rigidity, increased creatinine, phosphokinase, and tachycardia, sweating are here. Here are the symptoms of the NMS. Here also they will tell weeks to months, but we can easily identify with the symptoms, and treatment is going to be what? Treatment is going to be your dandolin, which is the muscle relaxation. That's it. From this one, pakka sure shot one question, or they will ask this one, or else they will ask the question from here. What are the side effects of the particular drugs? Okay, now see, see, see here all the drugs here. Okay, now these are all are atypical. Okay, now these are all are atypical drugs. Okay, now they all are atypical drugs, meaning they are going to block both D2 and 5S2. Okay, na? Remember, see the olanzapine here. Olanzapine, what is the side effects here? It's the weight gain. See olanzapine. Oh, big O means what? The egg. Okay, means it's what? Fatty. Okay, na? So egg means what? Olanzapine. It is large means what? Weight gain. That's why it's containing in the diabetes. See risperidone. It is the see among all this one, which among all the atypical antibiotic, atypical antipsychotic, which one is having more EPS? Risperidone. Among all typical, it's going to be your haloperidol. Among all atypical, it's going towards the what? Risperidone. It also called the hyperprolactinemia. So that's why it must be given with the what? Anticholinergic. Okay, na? That we can give with the trihexyphenidyl. Next one, the giprasidone. Giprasidone, what happened? Giprasidone, it causes what? It causes increased QTC interval. As the increased QTC interval. Remember, in the giprasidone also there is what? There is a less weight gain. There is a less weight gain. Okay, na? Remember, and also there is a eripeprazole, there is a partial D2 agonist, has less weight gain and safe in menstruating birth giving women. Remember, all the antipsychotics they are having the side effects as the weight gain. But remember, eripeprazole and giprasidone, these are the only two drugs which having the lesser side effects as the weight gain. Okay, now, but the most safest is the eripeprazole. So you have to remember the question: the patient is obese or not. So you have to change the drug to the eripeprazole. Okay. Next is the clozapine. Clozapine having the anti-suicidal property, and this is for treatment of the resistant schizophrenia. What are side effects? The most common side effect is sedation, sedation, and also the weight gain maximum of the all. See, among all the antipsychotics, which drug having the most weight gain is the what? Clozapine. So you have to, there is a serious side effects. It is the seizure, which is a dose dependent, and there is a what? A granulocytosis. That's why you have to monitor the WBC count for first 6 months. Okay, weekly for first 6 months. Okay, na? Next, sometimes they will ask the questions also. They will ask the questions also from the antidepressant. What happens here in antidepressant? There is a what? There is decreased what? There is decreased serotonin and norepinephrine. In here in the case of the depression, but here psychotics there is a increased dopamine and the serotonin. But here it is a decreased norepinephrine and your serotonin here in the case of the depressant. That's why we'll get what? Depressed. So I remember some drugs here. So SSRI, SSNRI, okay, selective serotonin reuptake inhibitors. So we have examples of fluoxetine, sertraline, escitalopram, and SNRI, venlafaxine, fluoxetine. There is a NAS, there is a non-adrenergic specific serotonin receptors. There is a metazepine. See here, here is the question, guys. Fluoxetine, his brother name is his brother name is dapoxetine. Dapoxetine, remember the dapoxetine, it is used for the what, it is used for the premature ejaculation. Okay, na? Premature ejaculation. Remember here one thing, here also there is one drug, that is the paroxetine. There is a paroxetine. Just write down paroxetine, which is contraindicated in the pregnancy. Okay, na? Remember here, mirtazapine, it is having the very less sexual side effects. Okay, na? Just remember these points. Okay, done. Next one, anti-diabetic. Next one, anti-diabetic drugs. Oh my goodness! From this one, you guys, you are going to get one MCQ for sure. Anti-diabetic drugs here. See, the first one here is the SGLT2 inhibitors. SGLT2 inhibitors. Okay, na? So actually, what happens, SGLT2? What is do? It will do the what, it will do the what, it will reabsorb the glucose. It will reabsorb the glucose from the blood. But these drugs, dapagliflozin, empagliflozin, they are going to block this receptor. They're going to block this receptor. So that's what, all the, see here, all the glucose in the from the blood is going to directly what? They are not going to reabsorb. They are going to what, they are going to directly, they are going to coming out from the urine. Okay, na? So that's why it causes what? It causes the what, glucosuria in the urine. So what? Whenever there is glucosuria in the urine, what is the side effects of it is a UTI. It is the UTI, genital mycotic infection, pons gangrene, and also remember there is also also causes the weight loss. Okay, na? And also whenever there is a what? Glucosuria, whenever there is a glucosuria, obviously there is going to be what, loss of water also. Loss of water also. So which is safe in the what? In the heart patient also, na? In the heart patient also, in the heart failure also, you have to do this one, na? In the congestive heart failure, there is a fully fluid overload. But if you give this drug, the fluid will come. So there is a decrease pressure on the left ventricle. So this is preferred in the diabetes with the what, heart failure. Next one, there is a DPP inhibitors. See, all the names of these drugs are starting with the are like a girl name. See, Sita, Vilda, Lena, Saksha. Oh my goodness. Sita, Vilda, Lena, Sakshi. Hi Sakshi. Hi Lena. Hi Vilda. Hi Sita. Okay, now see here. Remember one thing here. Remember one thing here. Remember one thing here. All are, see, all are contraindicated in the CKD patient except Lena. Okay, Lena ko Lena. Which one? Lena ko Lena. Lena is my favorite girlfriend. Okay, na? Lena is my favorite girl. Okay, na? So I will take Lena. So Lena is safe in the CKD patient. This is the question. Also, what is the side effects of the DPP inhibitors? If you take long term, it causes the pancreatitis. Then next one, bigonites. I think you know the what is the what is the drug? It is the metformin. Remember, metformin is the what? It is the what? It among all this, it is the non-hypoglycemia. It causes the non-hypoglycemia. Okay, na? Remember, among all the anti-diabetic drugs, which drug is having the maximum? If you give this drug, your HbA1c levels will be fall down. Easy. So maximum reduction of HbA1c is with what, Amma? Is with your metformin only. With your metformin only. Remember, this is the question. See here. See the question. Next one. What are side effects? It causes the B12 deficiency, which causes the megaloblastic anemia. It also causes the weight loss. See, it causes the weight loss and also causes the lactic. It also causes the lactic acidosis. So especially in patients with the renal impairment, liver disease, and a shock, and also COPD. That's why you have to avoid this drug in the patient with the renal impairment, liver disease, and the shock. Okay, na? The other about the metformin. Next, sulfonylureas. Sulfonylureas. What happens, Amma? What happens? See here. Among all this one drug, which is the most hypoglycemic drug, it causes the now all these drugs, which one causes the hypoglycemia? It is the watama your sulfonylurea. That's why sulfonylureas are not given alone. It must be combined with the bigonides. Okay, na? Other drugs. Example, gliclazide, glipizide, and glimepiride. Okay, na? Next one. Next one, thio leader. Okay, na? Example is the pioglitazone. Pioglitazone. This is a PPAR gamma activator, which is a reversal of the what insulin resistance. So insulin resistance. Okay, na? Remember one thing about this one, it what happens? It causes the retention of water sodium. That's why it having a risk of heart failure and hypertension. That's why you must avoid this drug in cardiac patients. Okay, na? Okay, na? It also increases the risk of the bladder cancer. Okay, na? Mostly by what? Mostly by pioglitazone, and also increase the MI by rosiglitazone. That's why it must be avoided. It must be avoided with patient with the what heart failure. See here, diabetes with heart failure, you have to avoid the pioglitazone. Diabetes with MI, you have to avoid the pioglitazone. Okay, na? Next one is glucagon like peptide analog. Example, liraglutide and axinatide. So these are the having the side effects are the acute pancreatitis. Okay, acute pancreatitis, and also it increases the risk of the metabolic carcinoma of thyroid. That's why you have to avoid this in patient with the what thyroid carcinoma. Okay, so you have to avoid this one. If the patient have a UTI, you have to avoid the SGLT inhibitors. Okay, na? Next one, the alpha glucosidase inhibitors. Okay, here example acarbose. Okay, na? This is also non-hypoglycemic. Side effect is the side effect having what mal absorption of the GI. Okay, na? It is contraindicated in the IBD. So remember the longest insulin is the just deglutide, which lasts 48 hours. Okay, na? Remember one thing here. The patient with hypertension with diabetes, you have to use the telmisartan and you have to use the ACE inhibitors. These are the questions. So from this one, we'll get one MCQ. Okay, na? Don't ignore. Next one, remember this one. The following statement is false about the bedaquiline. So bedaquiline is a newer drug for the treatment of the TB here. Bedaquiline, let's remember here, bedaquiline, it can cause a significant QT interval. Yes, bedaquiline. So bedaquiline is a QQQT, QQQT, QQQT. It causes the significant QT interval prolonged. Yes, it recommended for use for combination with antiviral. Yes. It inhibits adenosine. Yeah, it inhibits the ATP synthesis. Yes, adenosine triphosphate synthesis of mycobacterium. Side effects include peripheral neuropathy. Oh my goodness, no, it is by the isoniazide. Okay, na? This is the wrong answer. Okay, so you have to remember about the bedaquiline. Okay, what the first line drug has charge? Everyone knows. Okay, na? See, remember the anti-TB drugs side effects are very important. Okay, first of all, let me point out. Which drug is very very safe in the renal failure? Isoniazid. Okay na? Which drug is contraindicated in the pregnancy? Pyrazinamide. Which drug is most hepatotoxicity? Pyrazinamide. It is the what? It is the it is the pyrazinamide. It is the pyrazinamide. Okay na? Pyrazinamide. Okay na? Pyarzinamide. Pyarzinamide. So most hepatotoxicity pyrazinamide. But in the pregnancy, it is the pyrazinamide. Remaining all are safe. Which is the more safer in pregnancy? It is the ethambutol. Your ethambutol is the more safer. Okay na? Remember, isoniazid it inhibit the formation of the mycolic acid. Okay na? It is a bactericidal. What is the side effect? It causes the peripheral neuropathy. Peripheral neuropathy due to what? B6 deficiency. It also causes the memory loss, seizures. And it is also a hepatotoxicity. It also a hepatotoxic, but not most. You know, but always the most is the paragenamide. It is safe in the renal failure. So there is a deficiency of the BBC. That's why it leads to the peripheral neuropathy. That's why you have to give the pyridoxine as a dose for the treatment, the 100 mgd per day. For prevention, it is the 10 mg per day. Okay, that's it. See, acinazide, there is a peripheral neuropathy. If you remember this one, it's very good. Next, rifampicin, RNA polymerase. It will in which the RNA polymerase binding to the RNA polymerase of the mycobacterium. It is also bactericidal. It is also safe in the pregnancy, but very very safe is the azamethambutol. Okay, na? So and the side effect is that it is also a hepatotoxic only. Okay na? But not the most. Most is the pyrazinamide. Okay na? Remember, it causes the RNA red discoloration in the urine. That's it. Next, the pyrazinamide is the most hepatotoxic. Okay, it inhibits the cell synthesis avoiding the pregnancy. It also causes the increase of what uric acid and also leads to the joint pain also. Pyrazinamide, okay na? Ethambutol, it inhibits the arabinosyl transition enzyme. It is also bacteria. It is bacteria. All the bactericidal. It is the bacteria static. Okay na? Side effects includes what high toxicity, that is red green blindness, which is the among all this one which is least hepatotoxic. It is the ethambutol. It is safe in the pregnancy, very very safe in the pregnancy. We have the new drugs are delamanid, pritomanid. It is which inhibit the mycolic cell wall inhibition. Okay na? And formation. Side effect is the QT prolongers. Okay na? So these are the things you have to remember from the anti-TB drugs. Okay, so remember here, ethambutol causes red-green color blindness. What happens? Sildenafil causes blue-green color blindness. Digoxin causes yellow vision. Thioridazine causes brown vision. See, from the leprosy, you have to remember the dose is important here. Okay, for dose is important here. Passive bacillary. Okay, na? From the passive bacillary, they will ask you what is the treatment first. What is the treatment for the for passive bacillary and what treatment for them for the multibacillary? They will ask you the dose. What the dose of rifampicin? Here it is 600 milligram. Dapsone 100 milligram. Okay, na? So you have to remember the dose. The dose is important. Okay. Leprosy. Next one. Coming to here, antibiotic side effects. A 6-year-old male child came to OPD with a complaint of soul pain. A history of intake of this drug over long time. What a drug. So age is 6 years only. Okay, na? Meaning his soul pain. Okay, na? So he was taking this drug. So mostly it is going towards the Vatama. If the child, see, he's the child. If child less than 18 years, if you are going to use the fluoroquinolones, and also in the adults, also in the adult patient, also in the adult patient, it will lead to Vatama. It will cause the damage to the Vatama cartilage and the tendon. Also called the cartilage and the tendon. There is going to be what Achilles tendon rupture, which causes the pain here. So fluoroquinolones you have to avoid in the pregnancy also, and also in the children less than 18 years and the adults more than 60 years. This is the question. This is the question asked in the in the last FMG exam. But they can ask you which antibiotics can induce the seizure. Can induce the seizure. Tell me, it is the what? It is the fluoroquinolones only. That's avoiding the epilepsy. It is a wide spectrum. Okay, na? It affects against both gram negative and positive. Okay, na? Which is the most potent is the ciprofloxacin. Okay, na? Our moxifloxacin are using as the eye drops. Best fluoroquinolone which is active against TB is the moxifloxacin. If you remember at least this, if you remember at least this, it's going to be it's enough. Next on the protein synthesis inhibitors, we have 30 years and 50 years. 30 years examples are aminoglycosides and your tetracyclines here. And 50 years chloramphenicol and macrolides are mainly. I'm just telling main drugs. Okay, now chloramphenicol causes the gray baby syndrome and it also causes the bone marrow suppression. Macrolides, erythromycin, okay, na? So erythromycin, if you take in pregnancy, it will cause the congenital hypertrophy or pyloric stenosis here. Okay, na? Just remember this one, okay, na? At least remember this one, right? Okay. See, aminoglycosides like streptomycin, gentamicin, amikacin, what it causes the what most common is the ototoxicity. Okay, most common is the ototoxicity. It also causes nephrotoxicity and also causes the neuromuscular blockade. Tetracyclines all are avoided, all are contraindicated in the kidney failure, But we can give the doxycycline and the tigacycline in the renal failure. It also avoid in the pregnancy because it will causes the dentition and the bone problems. Pregnancy and less than 8 years of all children. Okay, now if not given after expiry, if the date is expired, okay, now if you take the tablet of the tetracycline, it will cause the Fanconi. It will cause the Fanconi syndrome. Okay, now remember these points. Next one, doxycycline drug approach in the SIDH, rickettsia, LGV, granuloinguinal, cholera, prophylaxis for the leptospirosis and limb disease. That's what you have to remember. Next one, antimetabolites like sulfur drugs. Okay, now so sulfur drugs, what are the side effects? Is called the aplastic anemia, bilirubin displacement from the plasma protein. If it causes the bilirubin replacement from the plasma protein binding site, that's why it leads to what kernicterus, also called the crystalluria, SLE, hemolysis, and G6PD deficiency. Okay, also remember where you will use the cotrimoxazole in the pneumocystis jirovecii and nocardia and the burkholderia cephasi. Okay, remember these points. Okay. Oh my goodness, this is going to be your game changer. Okay, this is very important. This is really very important. Please remember carefully. Okay, if you read this slide by your own, my handwriting, you won't understand. Okay, okay, read it. Stop writing and listen carefully. Okay, so this is the first one is the mannitol. Mannitol. First one is what mannitol. Okay. Where does mannitol act? First of all, where does mannitol act? Mannitol will act on the loop of Henle. It will act at the loop of Henle. It will act at the descending loop of Henle. It will act at the thin descending loop of Henle also. Thin. It is a thick. It will act here also. Thin also. It will act at the descending limb of loop also. It will act at the PCT also. Okay, na? See, remember here, mannitol. One thing, remember here, mannitol, where you have to use the mannitol. Mannitol is used in the treatment of what? Treatment of cerebral edema. cerebral. They will give one case scenario. So, for example, a child got the meningitis and and he got something, and what is your and how you are going to treat or give the cerebral. As you know, the meningitis is called the edema, cerebral edema. So you have to give the mannitol. How much? I would 10% you have to give, and it is also used in treatment of the what acute congestive glaucoma, where you have to avoid, and also it is also used to for the clearance watermark. It is also used in the treatment of the lithium and the cisplatin toxicity, where you have to not give the mannitol. It is the watermark in the cerebral hemorrhage. The cerebral edema you can give, but not in the cerebral hemorrhage. And also you have to avoid this drug in the heart failure and the renal failure, and also in the pulmonary edema. That's it. Okay. So we are done with the asthmatic diuretic. We're done with the mental. The next one coming to the war, it is your acetazolamide. It is your acetazolamide. Here, remember, acetazolamide, where it act on the PCT. What it causes? It causes it inhibits the okay, it's inhibit the uh వాటర్ అనైడ్రేస్ ఓకే సిఆర్ ఏంటని మర్చిపోతున్నాను కార్బోనిక్ యాసిడ్ ఓకేనా ఇట్ ఇన్హిబిట్ ద కార్బోనిక్ యాసిడ్ inhibitors. It is the carbonic anhydrase. It is the carbonic anhydrase inhibitors. That's why it causes the loss of the sodium and the bicarbonate. If there is a loss of sodium and bicarbonate, what happens? This will lead to what? This will lead to what? Metabolic acidosis. So there is a metabolic acidosis which so this is the metabolic acidosis which increase the stimulation of the respiration. So it is used in the treatment of the mountain sickness. It is also used in treatment of glaucoma. Okay, na? It is also there is a loss of bicarbonate. It is also used in the treatment of the alkalination of urine and also epilepsy. Side effect is the bone marrow suppression. Then with the estrogelamide. Next one coming to here, loop diuretics. Where does loop diuretics will act? It acts on the medullary part of the thick ascending loop of Henle. What it block? It block the sodium potassium 2 chloride channel. What it block? Sodium potassium 2 chloride channel. Okay, now then next one. These are the for example, we are having the furosemide and the torsemide. Which is the longest one among this one? Torsemide. Okay, na? Remember, loop diuretics also all called as high ceiling diuretics. Okay, na? It was used in the treatment of pulmonary edema, acute heart failure, and the renal failure. Remember, what is the side effect? Loop, 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 lose, lose, lose. Loop, 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 lose, lose, lose. It causes it loses everything. It causes hyponatremia, hypokalemia, hypomagnesemia, hypocalcemia. My goodness. Okay, na? Lose everything. Okay. But coming to here, thiazides, what it do? It will block the reabsorption of sodium and chlorine, where at a cortical portion of the early DCT. What is early DCT? Okay, na? And also it causes a decrease in the calcium excretion. So there is a there is a hypercalcemia. There is a hypercalcemia here, and there is a hypocalcemia here. So if anyone asks you what is the drug of choice for the hypertension, simply hypertension, then you have to mark the thiazides. Thiazides are very good for the treatment of the hypertension. Where you will use the thiazides in the case of heart failure, idiopathic and also hypercalciuria, diabetes insipidus, and osteoporosis. What is the side effect here? See here, both your loop diabetes and thiazide causes the what causes hyponatremia, hypokalemia. Okay, na? See these two loop and thiazides are causes the hypokalemia. It loses the potassium. Oh my goodness! So that's why if you take this one, the patient who are on the loop dietetics or thiazides, they will always complain the muscle cramp due to the hypokalemia. But also thiazides are also having the high, they will also show the hyperglycemia, lipidemia, and also hyperuricemia. That's why you have to avoid this in patient with the gout and lipid disorders and the diabetic. Okay, na? But remember here, there is a potassium sparing diuretics, meaning they will not allow the potassium. They will decrease the loss of the potassium. They will decrease the loss of potassium. But here they will what amma? They will what? Here they will cause the hypokalemia. Here they will cause the hyperkalemia. Here they will cause the hyperkalemia. So they will save. They will save water. They will save water. They will save sodium. They will save the potassium. So you having the potassium sparing diuretics. We are having the two types here. Here we have the first one is the aldosterone receptor antagonist. We are having the spironolactone and the eplerenone. Okay, na? Remember these guys spironolactone. Okay, na? It also blocks the testosterone in males. That's why it causes the what? It causes the what? Causes the gynecomastia. In females, it is used for treatment of the estrogen and the PCOD. So remember where you will use these spironolactone in the case of the what cirrhotic edema, not pulmonary edema. Pulmonary edema it is the loop diabetes, but cirrhotic edema it is the what spironolactone, Cohen syndrome, resistant hypertension. Okay, na? Okay, na? In this condition, you have to use. Remember one thing, what is drug of choice for the diabetic nephropathy? It is your what? It is your phenyrenone. It is your phenyrenone. Phenyrenone is the drug of choice. New drug. It is also a aldosterone receptor antagonist. Now coming here, INAC inhibitors. INAC inhibitors are example amiloride and your trimetine. Okay, na? It also causes the what? It is also a potassium sparing diuretic. Where it will use in the case of lithium induced diabetes insipidus, nephrogenic diabetes insipidus, and also in the case of the Idle syndrome. Okay, na? At least remember this one. We are done with this one. Yes, you have to remember about the anti-cancer drug side effects. Mostly they'll always asking about the methotrexate, antimetabolized methotrexate here, which it inhibits what it inhibits the DFR, okay, na? Dihydrofolate reactase enzyme. What is the uses in the case of choriocarcinoma, psoriasis, and rheumatoid arthritis? What is the antidote for the methotoxicity? It is the folinic acid. It is what folinic acid. Okay, na? And also remember about this one. What is the use of mitomycin here? We are having the alkylating agents. We are having the example cyclophosphide. Remember, it causes the what? It causes the hemorrhagic cystitis. It causes phosphomide causes the hemorrhagic cystitis. So for the treatment of the hemorrhagic cystitis, we will give the treatment is the steroid, but prevention is the mesna for the hemorrhagic cystitis. Next one, what is the drug of choice for the gliomas? It is the temozolomide. It's temozolomide. This is also one question. See, everything I wrote here, everything is a question. Okay, na? Next one, coming to the drugs affecting. So here, antimetabolites we are having it is S-phase specific. Okay, na? Acting as S-phase. We are having the which affect the folic acid metabolism. It is the methotrexate. Which affect the purine metabolism. It is the what? 6-mercaptopurine, which having the side effect of the liver toxicity. Remember here, cladribine, the drug of choice is drug of choice in the hairy cell leukemia, and fludarabine is drug of choice in the CLL. So just remember this one, okay, na? From here, drugs affecting the pyrimidine metabolism. It is the what? For your 5-fluorouracil, which causes the side effect as what? Hand-foot syndrome. Hand-foot syndrome. Hand-foot syndrome. Okay, na? Here, remember this one? I know it's going to be it's going to be very vast. Maybe it maybe you these drugs maybe you will feel some like nervous difficulty to remember, but remember at least whatever I'm marking. Okay, na? See, which is the purine metabolism? It is the 5-mercaptopurine. Fluorouracil is the what am I? It's a pyrimidine metabolism. It affect the pyrimidine metabolism, which causes the hand syndrome. Okay, that's it. Next one, see here. Remember here, vincristine. See, remember here, vincristine will not cause the vincristine will not cause the bone marrow suppression. Okay, na? Bone marrow suppression. Remember, this is also one question. See, whatever I'm telling you, all the questions only, ra. Next one. Remember here, topoisomerase inhibitors. Remember here, your anthracycline in the etoposide etoposide 2 here, 2 inhibitors. We are having the what we are having the drug called anthracyclines. Okay, na? Anthracyclines. We are having the example doxorubicin, donorubicin. Okay, na? Rubicin, ruby a girl, ruby a girl. She what? She hacked the heart of others. She she is a she is a what? She's more beautiful. She always love everyone will love her. Okay, she Ruby. So it is a what? That's why loving or caring too much is very toxicity. That leads to what? Cardiotoxicity. Next one, platinum compound cisplatin for the what? For cervical cancer. So it is having the what? Orotoxic and nephrotoxic and vomiting is the most common side effect. Remember here, what are drugs causes the pulmonary fibrosis? Just remember. Remember here, bleomycin also it is a bone marrow sparing. It will not cause the bone marrow suppression. It will cause the flagellated pigmentation of the skin here. Okay, remember the BBCCM. Busulfa, see, bus sulfur. This is busulfine, bus. This is the bus. This is blue. This is bloro. This is the MIO. This is the drone here. Cycle here. This is the car here. Okay, na? This is the metro here. Remember what are drugs in the pulmonary fibrosis? All the names are like a vehicles. See here is the bus, here is the bloro, here is the drone here is the cycle here is the car here is the metro. Okay, next one. If you don't remember, if you are very confused about the anti-cancer drugs, please, I think there is one mnemonics like okay na. If you go, if anyone knows that mnemonic, this is the B shaped, okay na, B shaped here we have a B shaped lung here and pancreas C6 shaped. Okay na. I already shared this video in our group. Okay na. Please try to check this one. Okay na. Or just remember this one. If you remember this, very good. Next one, coming to the triple therapy, quadruple therapy, sequential therapy. Okay, this everyone knows this one. Okay na. Let me okay na. So these are the antibiotics you have to use this in the triple therapy. At least 2 antibiotics from this here. So these are the okay. Here we will in the quadruple therapy we will use the bismuth compounds as the covering agents. Okay na? Coming to the gout here, for the acute gout you have to use the indomethacin is the first line of choice. If NSAIDs are contraindicated, you have to give the colchicine is the most effective drug. Most effective drug is the colchicine, but always the first line is the indomethacin. Side effects include the myopathy, diarrhea, and also inhibit the granulocyte migration. For the chronic gout, drug of choice is the allopurinol, which inhibit xanthine oxidase inhibitor. Okay? This is the questions example. So it's important. Remember here one thing, read the question carefully. Read the question carefully. What they're asking. There are drugs. Remember that drug decrease in the production of the uric acid. It is the allopurinol. Purinol production. So A means absent. Absent means decrease in the production of the uric acid. That is the allopurinol. drug increasing excretion of the uric acid, that is the what uricosuric agent, that is the probenecid or lesinurad. Okay, na? Drug increasing excretion, that is the what probenecid. Drug increasing metabolism of the uric acid is what rasiburic acid, peglotic acid. Actually, guys, in humans, what happens in human, this uric acid, okay, now this uric acid will not convert into the which is not as water soluble. But in boats, it is a but in boat it will convert it to the what? It will convert it to allotine. It will convert to allotine. Allotine. That's why they scientists made one drug. They take this enzyme, whatever the enzyme is converting to the allotine. They take that is the uricase, that is the uricase enzyme, and they make one drug called rasiburic peglotin. So that's why this in human also uric acid will convert into allotine with the help of rasiburic. This is the very fastest way to decrease the uric acid. Okay, next one. As you remember, the selective COX inhibitors, example, celecoxib, reficoxib, which is which having the very less risk of causing the POD, but can increase the risk of the MI stroke. This is the question they asked in the last exam. Domperidone, everyone knows. Metoclopramide, okay, done. Everyone knows this one. Let's leave it. Next, prefer anti-emetic psychiatry. This is the water. Your amisulpiride and levosulpiride. Okay, na? It is also used for the treatment of hiccups in GERD. Can you tell me what is the drug of choice for the diarrhea? In HIV patients. Drug of choice for the diarrhea in HIV patient, it is the actidiotide. Okay. Actidiotide is the drug of choice for the what? Okay, na? Drug of choice for the for the spelling mistake maybe. Actidiotide is the drug of choice for the diarrhea in the pregnancy. Okay, not pregnancy, in the HIV patient. Okay. Next one, read the question carefully. Read the question carefully. A 68-year-old male complains that he needs to urinate frequently. Okay. Frequency, immense loss of urine without control. Immense loss revealed proportional. Okay, na? So guys, this is the case of the waterma. This is the case of your BPH. Okay, na? BPH. Okay, na? BPH. So which of the following? Here asking which of the following alpha blocker we use to treat does not produce the hypotension. Oh my goodness. So remember, it's going to be a psilocybin. Answer the psilocybin. Remember, in the anti-adrenergic drugs, we are having the C here. We are having the C, the selective alpha. We are having the selective alpha 1 blocker. Okay, now selective alpha 1 blocker. Selective alpha 1 blocker is having total two types. Alpha 1A blocker and alpha 1B blocker. See, alpha 1B, B for blood vessels, it will cause the vasodilation. It will decrease the BP. Okay, na? See, remember here. Okay. See, selective alpha 1 blocker, example prazosin, terazosin, daxozosin, alfuzosin. So if you give this drug, it will act on both alpha 1A and alpha 1B. So if you give this drug with the patient with hypertension and BPH, it will cause the two action. However, it's going to decrease the symptoms of the BPH, and also it going to decrease the it will also going to decrease the hypertension. So what happened here? So prazosin is going to must be given the patient with hypertension and BPH, because it acts on both alpha 1A and alpha 1B. Okay. That's it. See, if you are going to give this in a normotensive patient, if you are going to give this process in the normotensive patient, then what happens? It is going to cause the postural hypotension. Also remember the drug of choice for the scorpion sting is the it is also a prazosin. It is a prazosin. But remember, if you are going to give the alpha 1 blocker only, example tamsulosin, silodosin, it will only block the alpha 1A. So that's why there is it won't cause the decrease of the BP. So it will not cause the it will not cause the postural hypertension. So it is the alpha 1 blocker example tamsulosin, silodosin. Okay, na? So it is just for normal tenso BPS. So remember one thing, it will not cause the reduce the size of the prostate here. Remember here, there is one drug called alpha 5 alpha reductase inhibitors, example finasteride or dutasteride. It will reduce the size of the prostate, but it will take more time. It will take more time to reduce the size. But this tamsulosin, this tamsulosin, it will show the result within 2 to 3 days. It will, okay, now it will relax the what? It will relax the alpha 1A. It will block the alpha 1A, and it will cause the relaxations so that urine will flow. Then clear. Next one. For the overactive bladder, it is also called a bladder destro instability. So it is also called urge incontinence. We have to give the you have to block the M3 temperature. You have to block the M3 anticholinergic here. You have to block the M3 here so that examples there is overactive, so that if you have to relax the bladder, so you have to give the soft bladder. This is the mnemonic to remember. As for solifenacin, oxybutynin, fluoxetine, fluoxet, and tolterodine, and the darifenacin. You have to give these are the drug of choice for the overactive bladder. Okay, now see, we have to give the beta 3 agonist. Beta 3 agonist, what will do? These are the agonists. This will cause the relaxations. This will cause the relaxation of the what Gateway muscle. So it is this is also used for the what for the overactive bladder. We will use the M3 blocker, and we will also use the beta 3 agonist. Example mirabegron. See mirabegron means see megra bladder. Okay, na? So we are using in the case of the overactive bladder, beta 3 agonist is the mirabegron. Okay, done. For the stress incontinence, we are going to give you the pelvic floor massage and the duloxetine. For the bladder atony, we are going to or post-operative urinary retention or post-op ileus, you are going to give the M3 agonist, that is the watama betanachol. Remember one thing. Remember neurogenic, for the neurogenic diabetes, you are going to give the desmopressin, and nephrogenic you are going to give the thiazides. Okay, na? They are important. Remember in the myasthenia gravis, drug of choice is the pyridostigmine. First preference, then you can give the first preference is the pyridostigmine, then you can give the neostigmine. Okay, na? Drug of choice for the diagnostic we are using the what adrophonium. It is also called the what penicillin test. Okay, na? And remember here anticholinergic, here M3 blockers here. See for the cyclopegia test, that is for refractive test here. While you are rotating in the ophthalmology, guys, I think you may aware of this one. In adults, we will use the tropicamide eye drop for the because it is a very short acting. Children, we use the atropine because it's the longest acting. It is also a strong cyclopegia. But phenylephrine, which is non-catecholamine, which causes the mitosis, but it will not cause the cyclopegia. Okay, na? So guys, these are things you have to remember in the general pharmacology. So this is the first order and that's zero order. Okay, so in the first order as for first means this is the fraction is constant. In the zero order there is amount is constant. So in the zero order it doesn't matter. It doesn't matter how much the load is the load, but it will give the same exact amount. Okay, na? However, but in the first order, so for example, in our body there is a more drug. There is a more drug. There is a drug overload. There is a drug overload. There is more drug in our body, so that the rate of elimination is also more. If there is a more drug there is a drug overload in our body, then the elimination is also very fast. Here, it zero order reactions drugs, they won't depend on other. They won't depend that they don't care that okay, in my body there is more drugs so that I can eliminate faster, but they don't eliminate this one very faster. They will always eliminate in the same amount only. So what are the drugs which cause which what are drugs which follow the zero order? Mnemonic is the zero watt power, warfarin, alcohol, aspirin, theophylline, tolbutamine, and phenytoin. These are the drugs which follow the zero order. Remember here, this is the efficacy and uh, potency. Remember this one. This is the help is the mnemonic. Height, which efficacy. Okay, now more the height, higher the efficacy. So more the height, C, it is the C. So C is the most efficacious. Okay. Next one, the left. From the left, it is the more potency. So it is the left. Which one? The D. D is the more left. Okay, na? On the left. So most efficacy is what, amma? D, then A. Okay, na? You have to mark that like this one. Okay, na? Next one, the here they will give this. They will give this diagram graph. You have to mark the. Okay, so this is the what, amma? This is the antagonist. This is the antagonist. This is the agonist, meaning the maximum response, some response partial, no response here. Antagonist, there is a inverse response in inverse agonist here. This one, these are the clinical trials, phase 1, phase 2, phase 3, phase 4. Post marketing phase is the what, phase 4. Randomized criteria in the phase 3. Healthy individual phase 1. Okay, na? First time efficacy is tested in the phase 2. Okay, na? Remember, and also remember, guys, this one, this is a competitive and non-competitive. See this here, competitive. So here, this is happened. See here, this is the competitive. This is the competitive. Meaning there are two players. Remember, there are two players. They are going to participate in the competition. So they have to run very. They have to run very. We have to learn very long kilometers. Okay, they have to run very high. They have to run very faster in the more kilometers. Okay, na? More distance. So more kilometers. So in community there is a increased km, and they have to run in the same velocity. So it's the Vmax is the unaffected. So in this case one, they all are at the same. So they are not going to they are not going to run at the same speed, same kilometers. So it is the non-competitive. Okay, na? Yeah. This is the opposite is the non-competitive. This is the area under curve, area curve, meaning how much the potency, how much the extent of the, so how much the in how much time the drug is going to absorb. So this is the extent. If they are asking the extent absorption, there is AUG. Rate of absorption is the time here. In the last exam, there is one question about this, what is the T half. They already gave the elimination constant. So what is the formula for the T of? It is the 0.693 by K. K is the elimination constant. In the last exam, they gave the K value, it is 0.05. What is the T of life? So you have to remember what is the formula. T of how much? 0.693 by K. K is how much? 0.05. You will get how much? You will get 13.5 something. You will get. Just please check me, correct me, Next one, coming to the asthma drugs here. 45. Say here. Remember, read the question carefully. Here, okay, they are asking about the what, what is the mechanism of action of the what? Omalizumab. IgE. Okay, na? Then free IgE circulation. Okay, na? Remember, asthma management is important according to your GINA guidelines. According to the what, GINA. According to GINA guidelines, first of all, in the acute cases, you have to give the bronchodilators. Examples, what, your formoterol. You are in the inhaled and budesonide, you have to give in the very low dose ICS. If it is not relieved, it means it is the case of the what? Status asthmaticus. So we have to start with the epratropium, which is the anticholinergic nebulization. If it is not treated, if it not improve, you have to add the MGSO4. If not treated, you have to add the aminophilins. If it is not improved, you have to go with the injections, beta agonist, subcutaneous, you have to use the terbutaline and IV salmeterol. If not, again, if it is still not improving, you have to do the general anesthesia, you have to give the halogen inhalation and injection ketamine, and you have to put on the patient on the mechanical ventilator. Come to chronic or persistent asthma, drug of choice is the inhaled corticosteroid. If there is a less than one attack per day, you have to give it. Means it is mild, you have to give the ICS low dose. There is at least one attack per day. It's moderate case, you have to ICS medium dose plus LABA. Bedridden patient means they are not able to walk. Also, you have to, it is severe ICS, you have to give the high dose plus LABA. And refractory asthma, it is not going to improve with this one. You have to give the oral prednisolone, and the last year you have to give the monoclonal antibodies. Remember, we are having the beta 2 agonist. See, this is the beta 2 agonist, okay, which causes the bronchodilations. Then this is the agonist, okay, cause the beta, it causes the bronchodilation. So actually, the beta 2 agonists are good for the asthma, but M3 blockers and anticholinergics, these are good for the COPD. Example, epratropium, tiopetum. So remember, we are in SABA, LABA. SABA having short acting. It is for the treatment of what? Acute asthma. Example, salbutamol, albuterol, okay, albuterol. In the LABA, what happened in the LABA, long acting. Example, all the drugs are like a motor, okay, salbutamol, bambuterol, okay, so for, okay, all are, the names are like motor, okay, but remember, there is a formoterol. It is both LABA and SABA. Attach both LABA and, that's why it is used here in the at what formoterol. Ultra short LABA is the what used in treatment of chronic asthma, like indicator, okay, what are the side effects are important. Side effects, what happened, like tremors, reflex tachycardia, hypokalemia, hyperglycemia. It's called hyper, not hypo, it's called hyperglycemia, okay, next one is the ICS, inhaled corticosteroids. Example, fluticasone, mometasone, budesonide. Remember, this inhaled, oral, and IV. IV is hydrocortisone, oral prednisone. Remember, the inhaled are very, very safe in the pregnancy because it now causes the Cushing syndrome, SAS suppression. But these can cause the Cushing syndrome, SATS suppression. Okay, na? But remember, if you remember the inhalation, okay, inhaled corticosteroid, sometimes whatever they will stuck in the mouth, in the oral region, they will cause the oral infection. This is the infection called oral thrush, that is Candida. For the treatment, you have to give the statin. Remember one thing, there is one inhaled corticosteroid, that is the cyclisonide, which does not cause the oral thrush. Okay, na? Let's come to the monoclonal antibodies in asthma. This is omalizumab block the IgE. It is given subcutaneously every 4 weeks, and also is for the urticaria and the. I remember omalizumab. It is also is for the treatment of what? Sturge-Strauss syndrome. Just remember this one, and coming to your theophylline, theophylline is very, very important. The theophylline, it is it is available in the, it is also present in the tea, coffee, etc. So it is called what adenosine receptor blockers, calcium blockers, okay, na? But the most effective is the what PD4 inhibitors. These are the PD4 inhibitors, okay, na? Theophylline is also having the anti-inflammatory property because it's the histone esterations, okay, na? Also remember the theophylline is always required the therapeutic dose mounting. It is causes side effects of seizures and they will ask you which asthmatic drug will cause the seizure. It is the theophylline. Anti-inflammatory drugs, we are having the, like, see here, we have the mast cell stabilizers. You have to remember the mast cell stabilizer. We have a drug called as what? Sodium chromoglycate. It is used for the inhalation, only for the prophylaxis. Remember, but the drug of choice is the ICS. Next, 5 lipoxygenase inhibitors. This 5 LOX. It is what gelatin. It is your gelatin. This is your gelatin. It is your gelatin. See, LOX inhibitor, gelatin, which is the most hepatotoxicity. That's why we are not using this one. Next one, leukotriene receptor antagonist is a Montelukast. See, leukotriene receptor antagonist is the Montelukast, Jeffrey Lucas. In the case of the, in the case of the chronic asthma, and also Aspirin-induced asthma, remember what is side effect? It causes the Churg-Strauss syndrome. For the treatment of Churg-Strauss syndrome, what is the drug of choice? Is the omalizumab. Okay, na? They will ask the side effects. Okay, na? They will ask the side effects. Is important. Okay, na? All the side effects are important. Remember here, sometimes ipratropium sometimes causes the waterma, causes the pradi, causes the pradix, okay, causes the pradix, or a paradoxical bronchoconstriction. Okay, na? Okay, we are here. Coming to the CVS, CVS here. Always remember the first line while you are managing the hypertension for the rule with the A, B, C, D. First of all, you have to give the ACE inhibitors or ARBs, beta blockers, calcium blockers, and the last diuretics because diuretics cause what hypokalemia. Okay, na? Remember here always that they will ask you one thing, which drugs, okay, na? Which drugs, okay, na? In the CVS, in the hypertension, they will always ask you about the ACE inhibitor side effects. All like lisinopril, okay, captopril, okay, na? See here, what is the most common side effect is the what dry cough with the of what bradykinin. It will also cause the angioedema. It will cause the angioedema. It will also cause the what postural hypotension. As the postural hypotension. That's why it is contraindicated in the pregnancy and the hyperkalemia. See here, it causes the what contraindicated in pregnancy and hyperkalemia. That's why you have to not give this. You have not give this with what spironolactone. Spironolactone will also cause the hyperkalemia. So you have not give this there. It is contraindicated in the case of your bilateral renal artery stenosis. For this drug of choice is the CCB. For the unilateral, it is not contraindicated in the unilateral. For the bilateral renal artery stenosis, it is the drug of choice is the CCB. That's why it's contraindicated. For the unilateral, it is the ACE inhibitors. It also lowers the risk of diabetic nephropathy, reduce the resistance in the efferent arteriole of the glomerulus. It provides the mortality benefits in the heart failure patient or in the elderly. See, all these are very, very important. All these are very, 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 very important side effects. Please remember. Remember here, what is the also remember here what is the okay na the very, very important. Please remember master the side effects. Next, calcium channel blockers, the side effect is the headache. It also causes the what ankle edema, mostly with the amlodipine. Varapalin is used in the SVT. Diltiazem in the angina. Nimodipine is in treatment of what subarachnoid hemorrhage. Okay na? One thing I remember, one thing how to remember in the for treatment of the congestive heart failure, it is the digoxin. Digoxin is very important. It will what is the mechanism of action? It causes the inhibit the sodium potassium ATPase pump. If you block this one, then there is a there is an increase in the intracellular calcium, so that it causes the what does the calcium do? It causes the contraction. So there is a more contraction. So the contractility increase. So there is causes the inotropic action. Side effects is the vomiting is the most common. Arrhythmias, we have in the ventricular bigeminy, the most sensitive and the most common, and the most specific type is the paroxysmal atrial tachycardia with AV block. As I said earlier, it's called the yellow vision. It's called the gynecomastia. Tell me what is the disco drugs here? Remember here, digoxin, isoniazid, spironolactone, cimetidine, ketoconazole, and estrogens. Okay, na? What toxicity is called hypokalemia and hypercalcemia, and that is the digoxin or also called digoxin immune F antibody. Digoxin induced arrhythmia, you have to give the treatment what lignocaine. And here some special cases, drug of choice for the hypertension. They ask you only hypertension, drug of choice thiazides, emergency nicardipine, emergency in pregnancy IV labetal, emergency hypertension in pregnancy is oral labetal, resistant iter spironolactone, asthma you have to avoid the beta blocker, you have to give the CCB, osteoporosis you have to give thiazide, hypertension with pheochromocytoma it is a phenoxybenzone, hypertension in case of the cheese reaction, chlorine with the you have to give the phentolamine, telmisartan you have to give in case of hypertension with the diabetes, and also ACE inhibitors in the case of the whatever proteinemia. You have to give the patient with the hypertension and the proteinemia, you have to give the ACE inhibitors. Losartan, you have to give in the case of hypertension with gout. You have to avoid the thiazides and aspirin in the case of the gout. BPH plus hypertension, it is a whatever you are. BPH plus hypertension, you have to give to whatever. You have to give the prazosin. You have to give the prazosin. Okay, done. So remember one thing that here the BNP, here the BNP. Actually, BNP is very important for the BNP is very important. Brain natriuretic peptide. It will cause the what? It will cause the loss of sodium. So that's why it will also cause the what loss of water. But there is a one thing is that neprilysin. So neprilysin will cause the destruction of the BNP. So there is neprilysin inhibitors. Example, sacubitril. So it inhibits the neprilysin, so that there is more number of BNP. So which is for treatment of what? Congestive heart failure. Dobutamine for the acute decompensated heart failure. Norepinephrine for the cardiogenic shock. There is a low BP. Coming to the anticoagulants, I only remember one thing, which is direct 10A inhibitors. It is what apixaban. In the name is the epic. It is XXX 10A inhibitors. Rivaroxaban. Anticoagulant in pregnancy. You have to remember this one. Next one. So okay, this this you will master in the medicine also. For the PSVT, what is the drug of choice? For the atrial fibrillation, what is the drug of choice? For the WPW syndrome, what is the increase? What does Catis findings? Absent QS, wide QRS, what is the drug of choice? It is the procainamide. If there in any heart diseases, if no heart diseases, it is the flecainamide. This is the polymorphic ventricular tachycardia. It is also called a torsido. D point is treatment is the magnesium sulfate. This is a monomorphic VT. You have to give the water. This is the you have to give the water. You have to give the amiodarone in the stable. Unstable DC shock. Atrial flutter here. Two thought the okay. Start with the parents. You have to give the what? As you have to give the what? This one. Give the first you have to do the rate control by the beta blockers. Then you have to do the rhythm control amiodarone. See, this is you will study in the medicine part. Don't worry. I'm very fast right now. So this is the treatment of headache. I think everyone super and good. Remember one thing, everyone doing mistake here. Somatropin is contraindicated in patient of stroke and hypertension. Okay, now remember one thing here. There is one drug called lamicidine, which is having the lesser side effect of the watama coronary aspasm. So if there is no somatropin, if the patient is having this stroke history, hypertension, you have to give the watama lamicidine. Okay. Next one, antidotes. You have to remember antidotes are very important. Antidotes are very important. You guys are making mistake where if they ask, okay, na? In acute case you have to give the defruxamine. In the chronic case you have to give the deferiprine. Okay, na? So these are very important antidotes. Remember here from the hypothyroidism, most common cause is the Graves' disease. So which is caused the A plus acuitis. It is the whatever your carbimazole. Okay, na? Next PTU. The what is the your side effects called as the agramocytosis. Hypothyroid plus tachycardia, you have to give the propranolol. Hypothyroidism, it is the most common cause is the Hashimoto's, levothyroxine and thyroxine. In pregnancy, pregnancy पहले term में use करो. पहले term में use करो. First one is the PTU. Second intermission you have to use the carbimazole or methimazole. If you are going to use in the first time, what happens is called contralateral syndrome, which is a cartilage deformity. Coming to the malaria drugs, first trimester you have to give the if there is a caused by Vivax, you have to give chloro. In the false form you have to give the what fuck you. So sorry. It is it's fuck you. Okay, so sorry. It's a fuck you. This is a mnemonic. So sorry. Okay, na? It is the falsification. Artemisinin is in second semester. You have to give second semester. Remember, in the northern state of India, you have to give the artemether plus lumefantrine. In the rest of India, you have to give the artesunate plus sulfadoxine pyramid. For the last killing, you have to give the pyraquine. For the malaria, you have to give the IV artesunate. Okay, na? So that's it. So all the drugs for the management of eclampsia, pregnancy, we will study in OB-GYN. STD statement in this we will study in the case of your dermatology. Please remember the all the antiviral and antiviral and HIV drugs in the PYTS. Do all the PYTS. That is more than enough. And also please do the my pharma my 100 plus one liners. So it's going to be very easy for you guys. So at least remember this. Remember this. Please don't forget to master the 100 one liners, because we are going to cover everything. Anti-parasitic drugs also we are going to cover in there only, and few some drugs. Okay, now. Thank you very much, guys. Thank you so much. My duty time is okay. Thank you very much.